Irish healthcare system here. We've adopted the use of cloud-based systems for data collation. We're using power apps within laboratories to use in terms of testing results and capacity. We're using an artificial intelligence chatbot that could be used and has been used to triage potential COVID-19 cases to try and alleviate the pressures on clinicians.
We have a single source of truth. We have all these data in a data lake, and it now allows us to have a view of the prevalence of the disease, the demand on our services, and our capacity to deliver on those.
My main goal is to predict outcomes of cancer patients. We want to solve this by making a learning health care system. You collect data on every patient, whether it's private or public, and every hospital in the world. You use that with AI and things like that. You see what happens. And so our question is, can we get that circle running in every situation, every country, every hospital in the world, rather than just relying on what we do now?
And particularly around health identifiers, which are a key enabler for us to allow to integrate services.
General practice is a digitally fertile ecosystem. I think there's a proven track record of innovation in general practice from the early days of computerization through to the COVID-19 response.
The promise of data saving lives has never been as strong as today. If we look at the path of investment of Finland over the last 5 years, they have been able, in the Helsinki and Uusimaa region, 5.5 million people being served. They've been able to digitize more than 40 different pathways for patients and citizens.
Those type of technologies, those type of enablements, that's allowing us then to look at things like, to look at capacity and demand in a proper national way, in a way that we've never really been able to look at before.
Many times when we talk about health data, over recent years, we'd be looking at 2 months, 3 months old data. But in this situation, we were able to provide really timely data on it.
When you're looking at the government finances in totality in Ireland, it's almost always the case that you have to look at health very, very seriously. It was always a sense that the health budget by the end of the year was going to exceed what the original estimate was. Not an awful lot has changed.
We do spend a lot on healthcare in this country, but percentage-wise, we spend less on information systems, on e-health solutions, on ICT than our peers in other European and Western countries. And even when we were to compare the percentage spent in the public healthcare system going back in time, we're spending a similar percentage as we were about a decade ago.
If you look at the US system and you look at what could be delivered digitally, you could take out of the system $250 billion.
But now our organisation has realised, OK, now by using the IHI and, by the way, Aircode, which is another particular favourite of mine, we can actually track a person across a complete pathway, irrespective of where it starts.
Looking at sort of the need for cost containment in certain areas, to have a sort of a comprehensive review of technological spending in the health service in Ireland, to see, is it possible, almost in some cases, possibly to have sort of very, quick wins in certain areas that for marginal elements of expenditure, you could be generating great efficiency.
And I think some of the issues which we have had during COVID-19, during the cyber attack, has showed that in many parts of the system, we are still using, quite antiquated technologies, like I said. So at a very basic level, I do think just bringing us up to, a minimum standard so that we can access, quite basic information in many respects.
So resources is an issue. That's the administrative problem. Federated data infrastructure is what we feel in the Netherlands is the long-term goal.
The pandemic for us really accelerated our ambition to become a data-driven organisation. And what we thought would take us a number of years to achieve has been achieved in a number of months. This infrastructure will be used, and this approach will be used to leverage our other challenges that we face across the health and social care system, such as, for example, addressing the waiting lists.
And even in relation to the plans that have been made about what we're going to do next, it's all about now, yes, getting the data, getting IHI, being able to follow people through a pathway in an integrated way.
Even if we were able to go 60-70% as fast as some of the things we did in COVID, wouldn't that be amazing for the Irish health system?
we have the ability to realise what operational resources we have to put in place to meet the demands of that patient wherever they are.
You know, we've been hugely successful in the adoption of digital to drive impact and positive impact in healthcare. There's a requirement to continue that in some way. There's a requirement to look at this now at a strategic level. And I think, going back to my earlier point, my opening, I think Sláintecare requires huge emphasis on this and an integration of the technology side within the main core of the delivery of Sláintecare to be successful.